The first question, which is about evaluation of China and North Korea's COVID-19 policies. So the questions are, while China sticks to its stringent COVID-0 stance, despite the relative low confirmed cases in China compared to the rest of the world, North Korea seems to get ready to ease the preventive measures by emphasizing that the COVID-19 situation in Pyongyang is under control. So how do you evaluate the performance of Beijing and Pyongyang in fighting against the pandemic? And do you think North Korea will seek the help of China or outside world to end this public health crisis?
Well, this is a very interesting question, right? There were a couple of weeks ago, there's this story, right, in Chinese social media talking about how, right, the Korean leader, right, were telling their people, that the fear of COVID is even worse, right, than the pandemic itself, right? So indicating, right, that North Korea seems to be aware, right, how, right, this social economic impacts of the pandemic, can be much bigger a problem, in coping with the pandemic, right? And certainly what China has its lessons to learn here, right? Because of its adamant pursuit of a zero COVID policy, right? Basically, they cannot tolerate any infections, right? Even though, right, the new variant, I'm talking about the Omicron, right, is becoming much less severe, than the original variant. But this mass vaccination, right, has essentially made it, less deadly disease, And in the meantime, the cost, right, of pursuing such an approach, right, it's much higher, right? We are seeing, right, the free fall of China's economy. We are seeing this heightened social discontent in China because of this lockdown measures, right? So in that sense, I feel like North Korea seems to be doing a better job, than China, right, in dealing with this crisis. But in the meantime, there's indeed a lot in common between the two, right? Both, right, are still pursuing. I believe there's maybe arguably the two only countries that are still pursuing a zero COVID approach, right? And initially, they both seems to be quite successful, right, in enforcing that strategy, right? China used that to tout, right, the superiority of its political system. Korea for 2 years, by claim, they had zero case in the country, right? But now we're seeing, right, that China's zero COVID is failing rapidly, both epidemiologically in terms of spreading the local transmission, and economically, right, in terms of meeting, right, its economic targets this year. And in North Korea, of course, even though they're claiming, right, situation is under control, but we know, right, that there's just so many unknowns there, right, that there's this possibility, right, of a runaway outbreak, but it's still very likely, right? Not to mention now they're facing new public health problems, like recently this mysterious intestinal, right, diseases being reported in the country. Right?
Okay, so do you think North Korea is passing the worst phase when you see the trend in North Korea calculating their population?
Well, if you just look at the officially reported, right, data, right, the cases now have reached, right, more than, I believe, 5 million. That for a country with 25 million population, right, that's 20% of the population being infected, right? And I assume, given that, a lot of the cases are very likely went unreported, right? So the percentage of people who are infected might be even higher. you could say, well, they're quickly approaching, right, the herd immunity because so many people are being infected, but we know, right, Omicron, the BA2, right, the subvariant, that really, right, that you cannot expect, right, to achieve the natural immunity, by being infected, because people, you can repeat it, infection, right, is a problem. And now the vaccination rate, I assume there is still extremely low, right? They just started to administer the vaccines to the population. And that immunity level might be even further compromised because of the malnutrition problem in the country, right? So, I don't think they're out of the woods now. Right?
I see. Thank you very much. The second question is about the implications of health issues on the future power trajectory of East Asia. So you've conducted valuable researches about U.S.-China cooperation in these times of pandemic. So how do you expect the impact of this pandemic on the geopolitical landscape of East Asia? Will this have a long-term positive effects on the U.S.-China cooperation, and it will have some positive effects on the common global problems such as climate degradation and nuclear proliferation and others? And will the competition regarding the effectiveness of different regimes, so-called democracy versus authoritarianism, accelerate in dealing with competing crises? So how does public health crisis strengthen or weaken the strategic cooperation between many countries in East Asia?
Yeah, this a lot of questions here. I'm not sure I can answer, all of them to your satisfaction. But again, both countries, North Korea and China, they have pursued the zero COVID strategy, right? They used that to actually highlight the superiority of their political system. Right? This is in a way, this is the first time we're seeing ideology, right, that entered, right, the global pandemic response. When you frame, right, the global pandemic response as a competition between, right, liberal democracy and non-democracy or authoritarian systems, that further complicated, right, the global response to the pandemic. For example, when North Korea, right, is deciding whether to accept, right, the aid from South Korea, right, I think the ideology, right, a political concern might be an important consideration there, right? So, that might explain why North Korea, right, turned to China, right, for help, right, in terms of expertise, but they are very likely the Chinese experts there are advising North Korea on how to deal with the crisis, because Kim himself, right, praised the Chinese model, and in the meantime, they also, right, that sort of changed his position since January this year, start to import medical supplies from China, from ventilators to vaccines, right? So, that likely is going to strengthen the ties, between the two countries, right? Well, in terms of the U.S.-China relationship, right? Speaking of the cooperation of a climate, right? This interesting is the few areas, but that both the United States and China have incentives, right, to cooperate with each other, right? Interestingly, even though they have a long history, decades of history in terms of cooperation over public health, but this time, right, since the beginning of the outbreak, there were no serious conversation about cooperating with each other, right?
Mainly for political reasons.
In part, yeah, exactly, right? Mainly because the politicization of the pandemic over issues like origins of the pandemic, right? Whose political systems work better, right, in responding to the pandemic. I'm actually working on a project that promotes, but try to bring the two together for cooperating over global health security. But that is very difficult because, again, the politics still dominates the bilateral relationship. We talk about the November midterm elections, the U.S., and the 20th Party Congress in China, which make it difficult for both countries to compromise, right, or looking like a softer, right, toward the other side. But in the meantime, this crisis by North Korea highlight the need for the two countries to work together, right? Not just in terms of preventing the runaway spread of the virus, right? The potential emergence of new variants, right? We know that this new variants and new deadly, highly contagious variants more likely to emerge in unvaccinated population, right? But it also highlights the need for cooperation over issues like nuclear proliferation, right? Because, right, we are seeing how North Korea, right, is using this weapons test, including nuclear weapons test, to divert domestic attention and also seek more international assistance. So the need for the two countries and also other stakeholders, right, to work together, to deal with this crisis, remains very strong. Although, again, the political hurdles remains very high at this moment.
Putting politics aside, are there some areas in which United States can assist North Korea if North Korea doesn't talk much about nuclear weapons and politics?
Oh, absolutely, right. The United States can supply North Korea with more effective vaccines and therapeutic means, by like Paxlovid, right? But my understanding is that North Korea so far has not showing any interest in the U.S. offer. Right?
Thank you very much. The last area of questions is about South Korea's North Korea policy. So how do you evaluate the performance of South Korean government's efforts to fight against the pandemic from a very objective perspective? And what do you want to suggest to the new Yoon government about the possibility of enhancing inter-Korean cooperation based on public health challenges in both Koreas? And how can South Korea and China cooperate and pursue common policies to promote peace and stability on the peninsula based on this dealing with the public health crisis?
Well, in terms of South Korea's response to the pandemic, I would give it an A.
Oh, really?
Since the beginning of the outbreak, right, they have managed to balance the pandemic control and the social economic stability. Right? They have also rely on high-tech means, right, like apps to track people's movements, tracing, but they have not. This has not compromised democratic standards, which I found is quite accomplishment, right? And the government has also been very adaptive, right, in responding, to the new situations, right? They have, I think, not long ago. Well, I think this, since 2020, my understanding is that they have, shifted strategy, from preventing infections by a containment-based approach toward a more mitigation-based approach that focuses on treating severe cases and reducing death. I think this is the right strategy, especially since the Omicron wave arrived in South Korea, I believe in March, so we are seeing actually the rapid increase of the cases, right? But the health system remain robust enough to withstand the pressures, the challenges, and the death rate remains very low. I did the calculation; it's about 0.13%. That is very close to the mortality rate of severe influenza. And it's much lower than the U.S. level, which is like 1.2% almost. So I think that is quite a successful strategy, there's a lot, I think, of other countries can learn from the Korean experience, and if I could offer any advice to the Korean government, in terms of what they can offer to the North, certainly I believe they have offer, the vaccines and other aid to the North, but I believe the North has essentially didn't respond. So I think maybe it might not be a bad idea in terms of placing the South Korea's response or integrated this offer into a multilateral efforts to help North Korea. We basically South Korea the work with countries like China and international organizations like WHO, the Gavi, the COVAX pillar, to help North Korea to basically bring the situation under control, which we know is in South Korea's interest. And I think here, there's South Korea could work with China, to pursue common policies to promote peace and stability in the region, China, for example, South Korea could provide the China with the more effective vaccines and even the therapeutic means, which to send these medical supplies to North Korea through China, So I think that would be a win-win for both. So,
I think your suggestions for multilateral venue to help North Korea is a great one, and also trilateral cooperation between two Koreas and China will open a new way of cooperation, and also by having more cooperative mechanism, we can increase the level of cooperation between United States and China in the long future. So I hope that global health crisis might be a platform for further cooperation in East Asia.
Absolutely. Actually, I think South Korea could play an even more prominent role in U.S.-China cooperation over global health security. We just had the meeting last week on strengthening America's health security, on strengthening the U.S.-China cooperation over public health. Because now, basically, there is no serious conversation, or dialogue between the two. Again, because of political hurdles. So we are planning to have a track 1.5 dialogue between the two countries through this face-to-face, dialogue between officials, scientists, public health officials, and thought leaders to basically by sitting at the same table to talk about issues related to global health security, right? But because of the travel restriction measures imposed by China, we are thinking of having South Korea, the Seoul, as a place, for the bilateral dialogue. So that this is the one of the plans we are having.
Sounds great.
Yeah.
Okay, thank you very much for your great thoughts and good suggestions to our government. Thank you very much.
My pleasure.